So these are the learning objectives, learning how gender must be considered in diagnosing and treating psychiatric conditions. How do you like that? I am a psychiatrist, and so I really come to this from starting at the brain, starting from mental health. But it turns out, as we know, that the brain and the mind don't stop at the neck, and the whole body is involved. So that got me into studying integrative medicine, or now it's called functional medicine. And really, if you have a problem in your brain, it's really a reflection of a disorder somewhere else in your body. Doesn't that just make sense? And that's what we're all here to learn about. So you don't have to be psychiatrists to know that there are biochemical influences on mood, and particularly the topic of my talk today is about hormonal influences on mood. And that we can correct these imbalances. Just as we've been correcting hormonal imbalances for all other purposes, we're also doing it for mental health purposes. Okay. We already went through my bio. We don't have to repeat that one. And as I mentioned, the brain is an organ. And very often in psychiatry, that isn't really attended to. But it's this little 3-pound organ that uses 20% of the nutrition of the body. It's a very hungry organ. It's made up of neurons and glial matter, and they communicate. These neurons communicate via neurotransmitters. There's little gaps between the neurotransmitters, between the neurons, and the neurotransmitters are chemical messengers that actually communicate by going from one neurotransmitter to another. And they're affected by what you eat, by your body chemistry, your physiology, and your hormones. And it's so interesting. For years and years and years, if you can remember, some of us have been around for a long time, a lot of research was done on men because women have these kind of annoying things called mood swings and hormones. So 50% of the population was actually excluded from a lot of medical research, a lot of drug research. I mean, is that bizarre? Anyway, that is no longer the case. But women are really very different physiologically. Because of our hormones, women have a higher incidence of depression, fibromyalgia, autoimmune disease, are much, much more sensitive to alcohol. You've heard here in talk after talk. For men, 2 glasses of wine a day. For women, 1 glass of wine a day. Why? Women don't tolerate it as well. We have more fat, okay, and the alcohol goes into the fat cells. And we are more prone to cancer from alcohol than men are. So, and women get breast cancer from it. So these are all the issues that make men and women distinctly different, and that we as physicians need to really pay attention to this. And of course, women have these condition-specific, hormone-specific conditions, PMS and menopause. Of course, men suffer from PMS and menopause too because they are living with women who have it. So it really behooves men. I have a lot of grateful men in my practice because I've treated their women partners. So men need to learn about this too, even non-physicians. So what happens? We have come into our practice. What do we see? Okay, we see depression, including postpartum depression, which obviously is hormonally related. We see anxiety, fatigue, brain fog, poor memory. These are all what? Psychiatric conditions. Sexual dysfunction, perimenopausal symptoms, postpartum depression, GI fibromyalgia. And these are often treated as psychological. How many patients do you know that were sent to a psychiatrist with these issues? This is crazy. Well, if they come to me, and I'm a psychiatrist, I will do lab testing and start to do some hormonal work and really do a whole physical workup. But for the most part, these are very much treated like psychological issues, which there is a psychological component and there is a mind-body component. And I'm very aware of that and very involved in helping people use the mind-body connection. But that doesn't mean that we ignore the body-mind connection. It's just you use a full-court press. You use the body to affect the mind and the mind to affect the body. Now, so conventionally what happens? A patient comes in with any one of those symptoms that we mentioned, that whole big checklist. What happens? 5 minutes, 10 minutes, here's a prescription, right? Here's your Prozac, your Celexa, your Zoloft, or neuroleptics. So now it's not only the antidepressants, not just the SSRIs or the SNRIs, but now neuroleptics are added in. Why? It's mostly marketing. I don't think they make that much of a difference, but they do bring in a whole new side effect profile. The neuroleptics are particularly dangerous. Neuroleptic malignant syndrome, tardive dyskinesia. These are serious, serious, serious problems. And it's harder to get off of them. It's hard to get off the SSRIs, and the SSNRs are even harder to get off of. And then the neuroleptics, really hard. And the anti-anxiety agents, very difficult. Benzos and so on. And even the ones that say they're non-addictive are quite addictive. So you have to be very careful. If you're prescribing an anti-anxiety agent, be sure you know be sure you have a really good idea why you're doing it, and that there isn't really a natural substitute. And for the most part, there generally is. And then, of course, for menopausal symptoms, what had been before the Women's Health Initiative, it was pretty much synthetic HRT. So there's been some change because of the Women's Health Initiative study. So what are we looking at when we see a mood problem? What are we looking at? We're looking at the misuse of medications. We actually have side effects from medications. So people are on antidepressants, they're on anti-anxiety medications, and they actually have symptoms because of being on them or trying to withdraw from them. They have blood sugar imbalances. Now, that's not a really difficult condition to clear up, but if you don't know what you're addressing, you don't know how to do it. There's deficiencies, vitamin deficiencies, mineral deficiencies, amino acid deficiencies, essential fatty acid deficiencies, and we've talked a lot about that in this whole conference. Malabsorption. If you're not absorbing your nutrients, they're not going where they're supposed to go. Food and chemical sensitivities are major. They can really, really create havoc. And I have my patients do a food elimination diet. Of course, we can do lab testing, but the truth is the elimination diet is the cheapest and the easiest way to do it. I have found that with the testing, the allergy testing, the blood testing, there's a lot of variations, and there's variations from one test to another. From the same test, the same lab being done at different times, I'll get some slight variations, or split sample testing to different labs, I'll find variations. So it's nowhere near 100% reliable. It's sort of guidelines, but my preference is, again, the elimination diet. Chronic fatigue syndrome is a very common cause of depression. Lyme disease, fibromyalgia, some sort of chronic viral syndrome. Toxicity, heavy metals can really, again, create a lot of problems in the brain. And when the brain is out of order, when there's a symptom in the brain, what does it show up as? Mental health symptoms, psychiatric symptoms. So it's basically, if something's wrong with your GI system, you get a stomach ache. Something's wrong with your brain, it'll manifest as psychiatric symptoms. But that doesn't mean that talk therapy is the answer, or that a psychiatric or psychotropic drug is the answer.